Good day, my name is Crystal K. Tropanal, BSRT 3C, introducing to you the projections of lower extremities. The first projection will be the AP or APHL projection. Instruct the patient to sit at the radiographic table, flex the knee, the affected knee, and flex the foot in contact with the IR. Be sure that we gonna using secondary marker since it is the right foot, we will be using the right marker. Now, the central ray will be perpendicularly directed to the third or base of the third metatarsal. Now, since the foot is angulated or may angulation po ang foot natin sa base part, doon po na-discover ang APHL projection. So, we will be using angulation of 10 degrees posterior through the base of the third metatarsal. So, this projection shows the interphalangeal joints spaces and the metatarsal joint spaces are well demonstrated. The second projection will be the lateral or lateromedial projection of the foot. Instruct the patient to rotate towards the unaffected side. Yeah. Still, we are using the secondary marker. Ayan po. Now, rotate the patient towards the unaffected side, placing the medial side of the foot in contact to the IR. And this still, the central ray is perpendicularly directed to the base of the third metatarsal. Okay. Next projection will be the APHL weight-bearing composite method. This projection will be a unilateral method. Ibig sabihin po, one foot at a time. And then, this projection will be going, we will be doing 2 exposure in 1 foot. Now, instruct the patient to move the affected side forward or 1 step, placing it in contact with the IR. Now, since this position, we will be decreasing the SID to 40 inches. Now, the central ray will be angulated at 15 degrees through the base of the third metatarsal. Next exposure will be, let the patient move her unaffected side forward or 1 step forward. And the central ray will be 25 degrees perpendicularly directed posterior aspect of the ankle. Okay. This shows the entire foot free from the lower leg. Okay. The fourth projection will be, next projection will be the APHL medial rotation of the foot. Instruct the patient to sit at the radiographic table, flex the knee, place the foot in contact to the IR. So, this projection has angulation with 30 degrees in relation to the IR. Ayan po. Ayan. So, the central ray will be perpendicularly directed to the base of the third metatarsal. Now, this projection shows the side up. Now, this demonstration shows open interspaces of between talus and navicular bone, between cuboid and calcaneus, between cuboid and fourth and fifth metatarsal, and also cuboid and lateral cuneiform. Now, next projection, which is kabaliktaran po, medial rotation, which is the lateral rotation of the foot. So, same position, iiba lang po ay ang rotation ng foot 30 degrees laterally in contact or in relation to the IR. Ganyan naman po siya. The same central ray which perpendicularly directed to the base of the third metatarsal bone. Now, this demonstrates the medial side of the foot and it shows open interspaces. Okay, the fourth projection will be the plantodorsal, which is part of calcaneus, axial plantodorsal. Now, instruct the patient to be in supine position since maiksi lang po ang upuan namin. Pinasandal ko na lang po siya. Now, the knee is extended. We will be using the 8x10 plate since calcaneus lang din naman po. Yan. Hindi ko po nilagay sa center ang calcaneus part because of the angulation po later on. Now, ensure that the foot is in dorsiflex. Ayan. Make sure that the long axis of the foot is perpendicular to the image receptor and will meet 90 degrees. Now, the central ray will be perpendicularly directed to the base of the third metatarsal with angulation of 40 degrees cephalad. Yan. Tinawag po itong plantodorsal because it enters on the plantar surface of the foot and exits on the dorsal surface of the foot. Now, this demonstrates the axial image. It is also shows the calcaneus free from superimposition of all the bones. Okay. Next projection will be the AP projection of the ankle. Now, instruct the patient to be in supine or in seated position. Extend her limb and foot is in contact with the IR. Now, make sure that the foot is in dorsiflex. Yan, dorsiflex po. Para perpendicular pa rin po yung foot at ang IR natin meeting 90 degrees. Ayan po. Now, the central ray will be perpendicularly directed to the ankle joint. Ayan po, dito po. Now, this projection shows distal tibia and fibula and tarsal bones. Yan. Now, next projection will be the lateral projection of the ankle, the lateromedial. Now, instruct the patient to turn towards the unaffected side. Ayan. This projection will be harder than the mediolateral. The central ray will be perpendicularly directed 1/2 inch superior to your lateral malleolus. So, i-measure po natin 1 inch, kunin po natin ng half, dito po natin kukunin dito po, magdadirect ang ating central ray. Yan. So, this projection shows the superior aspect of the calcaneus. Next projection will be the ankle mortise. So, instruct the patient to sit or in supine position po. The knee is extended or the limbs are extended. Make sure that the feet is in contact with the IR foot. Now, this projection needs to rotate the entire limb 20 degrees. 15 to 20 degrees. Ayan po. Now, this projection needs the central ray of perpendicularly directed midway malleoli. This projection shows mortise joints open. Projection will be the Ishmael method, 3 ways to do it. Now, the first projection will be the apiaxial oblique medial rotation of the foot. First, instruct the patient to be in seated position or in supine position. Now, extend the limb. Ensure that the subtalar of the patient is at the center of the IR. Now, since may axial po ang ating projection, we will be rotating the feet of the patient 30 degrees medially. Now, the central ray will be 1 inch distal to the malleolus and 1 inch anteriorly. So, pointing here, this will be the central ray, but we will be using angulation of 10 degrees through the said region. Now, this projection shows the middle articular facet and the mid-subtalar joint. Now, next projection will be the apiaxial oblique lateral rotation. So, ang pinakaiba lang po nila is i-rotate po natin ang foot ng patient 30 degrees lateral. Dito naman po. So, the central ray will be directing 1 inch. The central ray will be directing 1 inch posterior to the malleolus. So the central ray will be has angulation of 10 degrees through the 1 inch posterior to the malleolus. So this shows the posterior articulation facet and posterior subtalar joint. Next projection will be the lateromedial oblique medial rotation. So, in this projection, we need to flex the knee of the patient. Yeah. Placing the plantar surface at the center of the IR. Now, we have to rotate the foot. We have to rotate the foot 45 degrees medially. Now, Kaya po siya tinawag na lateromedial. It is because the central ray will be entering at the lateral side of the foot and exiting at the middle side of the foot. Now the central ray will be 1 inch distal to the malleolus and 1 inch anterior from the 1 inch distal of malleolus. So dito po papasok ang ating central ray. Yan. This projection shows the portion below the talus and the superior portion of the calcaneus. This projection will be the knee, anterior, posterior position. Instruct the patient to be in supine position. We will be using the 10 by 12 IR. Ensure that the knee of the patient is parallel to the IR. Now, in this projection, we will be basing the thickness of the pelvis patient. Now, if the patient's pelvis measures 19 centimeter thickness below, we will be using the 3 to 5 degrees cephalad central ray. If the patient pelvis thickness is 24 centimeter, we will be angulating the central ray 3 to 5 degrees caudal. But if the patient's thickness is 19 to 14 centimeter, the central ray will be perpendicularly directed to the patella. Now, ensure po natin na naka-straight ang paa ng pasyente. Ayan. Hindi po gumagalaw. Now, we will be measuring the thickness of the patient's pelvis. So, kinakapa po natin yan. So, dito po. So, the measurement of the thickness pelvis of the patient is 13 centimeter. That means that the central ray will be angulated 3 to 5 degrees, 1/2, so dito po, of the patella or apex. Ayan. Dito po siya papasok. Now, ensure po natin na hindi gumagalaw ang paa ng pasyente during exposure. Ayan. This projection shows the open femoral joint space, the proximal tibia and fibula, and also the distal femur. Next projection will be the lateral projection of the knee, but in medial-lateral projection. Now, instruct the patient to be in lateral recumbent. So, the patient must lie towards the affected side. So, ito po ang knee na affected. Sige. Edit po. 30 degrees. Itong unaffected side po is mas iharap po natin siya. Ayan. Para po hindi, para po mas maging comfortable po ang ating pasyente, lalagyan po natin ng patungan ang kanyang unaffected side. So, naka 20 to 30 degrees po ang ating knee. Naka-flex po ng 20 to 30 degrees ang knee ng patient. Ayan. The central ray will be entering the 1-inch knee distal to the medial condyle. So, dito po siya papasok. This projection shows the superimposition and lateral condyle, proximal tibia, and distal femur, and shows the patella free from superimposition. Okay. Next projection will be the tangential whole blood method. This method has 3 projections, but I chose the original projection, which the patient require to kneel. Now, ensure that the knee of the patient is in contact to the IR. Sige, yan. Naka-center po ang knee ng ating pasyente. Now, as you can see, the femur of the patient's is at 70-degree angulation. The central ray will be perpendicularly directed to the lower leg. Ayan. Okay. Relax. So, this projection shows a very good demonstration of Huang blood and femoral condyles and luminescence and intercondylar fossa. Next projection will be the apiacial Beckler method. So, kailangan po naka-flex ang knee ng patient 60 degrees only. Ganyan. For the patient comfortability, kailangan po natin ng sandbag. But, gagamitin po natin ang kumot. At ilalagay po natin ang IR dito sa baba ng knee ng pasyente to lessen the OID. Now, the central ray will be directly perpendicular to the knee of the patient. Ayan. This shows the intercondylar fossa and intercondylar endymions. Okay. Projection will be the Camp-Coventry method. So, kailangan po naka-prone ang patient natin. Okay. Lalagay po natin papatang po natin dyan ang paa ng patient. The knee is flexed 40 to 50 degrees. Ayan. Now, for the patient comfortability, kailangan po natin ng sponge para patungan ng paa ng pasyente. So, now, the central ray will be 40-degree angled toward the lower leg. 40 degrees. Shows the intercondylar fossa free from superimposition and intercondylar eminences. Okay. Next projection will be the merchant. These projections, itong mga susunod po natin mga projection will be called a sunrise venture. So, unahin po natin ang merchant. Instruct the patient to be in seated position. So, since 40 degrees naman po ang angulation ng knee or flex ng knee natin, pwede naman po siya umpo sa at the end of the radiographic table. So, saan po natin ipasok ang ating IR? Between both patella. 1 foot distal to the siya papasok. Ayan. This projection will show a magnified image of the patella and patello free from superimposition. Next projection will be the tangential centigent method. Do not do this if the patient has suspected transverse fracture. So, ang dinedemonstrate po ng projection na to is only vertical fractures. So, instruct the patient to be in prone position. And lagay po natin ito sa below. Make sure that the knee is parallel to the IR. Flex the knee 90 degrees. So, nakaganyan po. Straight po. Straight. Ayan. 90 degrees. The central ray will be perpendicularly directed to the IR. So, inuulit ko po, this projection demonstrates a vertical fracture. Okay. Next projection will be the leg anterior-posterior projection. So, unahin po natin ang anterior-posterior projection of the leg. So, instruct the patient to be in seated position, dead blocker. In this projection, there will be two images in one film. So, ang una po natin is AP projection. Now, the central ray will be perpendicularly directed at the midpoint of the IR. So, yan po. Okay. Next, this projection shows the distal part, tibia and ferrus, and also fibula interminens, interspaces proximal to the tarsal bone. Next, remove po muna natin yung paa ng pasyente. Now, we will flip the leg blocker. Ayan po. Lie towards the affected side. So, ensure that the malleolus is included. Ayan po. Slightly flex the knee of the patient. Ayan. Ensure that the femoral condyles are parallel to the IR, and the central ray will be perpendicularly directed to the midpoint of IR or the midpoint of leg. This projection shows the femoral and tibia completely not superimposed, and superimposed femoral and tibia are superimposed. Tibia condyle. Now, next projection will work in anterior-posterior projection. Instruct the patient to be in supine position. Now, ang IR po natin ay nasa ilalim ng ating pasyente. Now, let's see. Ensure that the border of the IR is at the level of the axis to prevent cut-off, and the lower border must include the femoral condyle. Now, the foot must be rotated 20 to 30 degrees immediately. So, yan po. If the patient has suspected injury, kahit wag na pong gawin ang rotation of the foot. So, the central ray will be perpendicularly directed at the center of the femur or the midpoint of the IR. So, yan po. This projection shows the entire femur, from neck less distorted, and proximal tibia and fibula if included. Next projection will be the lateral projection of the femur, placing the patient at the lateral recumbent position. So, itong knee po ng patient is slightly flexed. Ensure po na abducted ang dalawang limb para po hindi magkaroon ng shallowing. Be perpendicularly at the midpoint of the IR. Now, this projection shows the tiles are perfectly superimposed. Entire shaft is perfectly demonstrated, and also the femoral head. That would be all, ma'am. Thank you.